Hey there, can I ask you something? Are you dealing with jaw pain that just won't quit? Maybe it's tight muscles, clicking, headaches, and no matter what you've tried mouth guards, massage, medications, devices, even going all natural like I do it still lingers. I get it. That kind of pain can make everyday things, talking, eating, even smiling, feel like a struggle. And if you've had to give up things because of your TMJ pain, you're not alone. I help people who've tried everything for their jaw pain and still feel stuck. Through somatic movements, I teach you how to retrain your nervous system so your body can finally let go of that tension. It's not just about feeling better, it's about getting your life back. Before we dive in, let's talk about what TMJ actually is, because understanding is the first step toward real relief. TMJ stands for temporomandibular joint disorder, also called TMD, and it affects how your jaw moves. When things go wrong in this area, it can cause serious pain and discomfort. Believe it or not, around 5 to 10% of people, about 11 million Americans, struggle with TMJ pain. And for many, it's not just annoying, it's just downright debilitating. So, what causes it? Well, it depends. Sometimes it's a disc displacement. The cartilage inside the joint slips out of place and presses on nearby nerves. Other times, it's muscle spasms. The muscles around your jaw tighten up, making it feel stuck or even slam shut unexpectedly. There's also overuse or strain, like clenching your teeth or grinding your teeth at night while you sleep, or holding your mouth open too long, like at the dentist's office, or even singing. Injury or misalignment can mess with how your jaw moves. And if you're someone who cracks or pops their jaw on purpose, I have to be honest, that habit has to stop. No treatment will work if that continues. And then there's stress, one of the biggest culprits. Think back to a recent stressful moment. Did you clench your jaw? Tighten your shoulders? It's a super common reaction. Most people don't even know they're doing it, but over time, it could lead to chronic tension and pain in the jaw and upper body. You might even be doing it now. So, what does TMJ pain actually feel like? It's more than just jaw pain. You might feel tension or spasms in your jaw, in your neck, or even your face. Your jaw might feel tender and achy, and headaches or even migraines can become a regular thing. Many people experience locking of the jaw, where it suddenly snaps shut or pops open. You might notice clicking or popping sounds when you chew, or feel limited movement that makes eating painful. And when eating becomes difficult, weight loss can occur. Not because you want to lose weight or you're trying to lose weight, but because it hurts too much to try to open that jaw just to eat. That's what happened to me. Let me tell you about how I went from living with TMJ pain to living pain-free and how you can too. It was Thanksgiving Day about 13 years ago. I was sitting at the dinner table with my family, fork in hand, full of mashed potatoes, ready to dive in, but my jaw was locked. I couldn't open my mouth wide enough to even eat a fork full of mashed potatoes. It was miserable. I couldn't enjoy the holiday, and it was hard to enjoy company because I was so hungry, but I couldn't eat. It was just miserable. And I kept asking myself, how did this even happen? After years of never having any dental issues, not even a cavity until in my 40s, I suddenly needed a root canal and a crown. That one procedure led to months of severe TMJ pain. I had headaches, blurry vision, weight loss, and even social anxiety because I couldn't really talk to people very well and I couldn't sit and dine with them. I started feeling hopeless, like I'd never get out of pain. I went back to the dentist 6 times in 2 weeks, trying to get the crown adjusted so it wouldn't feel like I was holding my mouth hostage. I saw my chiropractor, got regular massages, all in an attempt to relieve the tension, but nothing gave me lasting relief. Now, here's the part that really hits home for so many people, because my story is just one of many, many people, thousands of people. There are people out there who've gone through surgeries, taken medications, tried injections, oral appliances, mouth guards, you name it, and are still living with pain. In fact, CBS Mornings aired a segment on April 4th, 2024, highlighting the heartbreaking reality of TMJ pain sufferers. They even question whether any of these treatments actually work. And here's the kicker. Most common treatments for TMJ are backed by little to no solid science. According to the TMJ Association, things like Botox injections and prescription drugs are often prescribed, even though the FDA hasn't approved any medications specifically for TMJ. Pain meds are either too weak or too addicting to even help or rely on long term. And that's what makes this so frustrating because I found a way to relieve my jaw pain without drugs, without surgery, without those uncomfortable oral appliances, without any invasive procedures whatsoever. And once I did get out of pain, I couldn't keep it to myself. I knew I had to help others escape the misery I went through. Here's where things get really shocking. According to a 426-page report from the National Academies of Science, Engineering, and Medicine, the dental field has long assumed that TMJ disorders are caused by misaligned bite. So for over 50 years, treatments have focused on adjusting teeth and bite alignment. But here's the truth. There's no solid evidence that a misaligned bite causes TMJ. That belief traces back to weak research done in the 1960s, and it's been repeated in poorly designed studies ever since. This wasn't just one person's opinion. The report was written by 18 medical and dental experts from major universities, and they found something deeply concerning. Most healthcare providers, including dentists, receive little to no training on TMJ disorders. Even worse, patients are often harmed by overly aggressive care and the lack of proven treatments. Let's pause on that. Most providers have minimal training, and patients are being harmed. That's not just frustrating, that's heartbreaking. Dr. Sean Mackey, a Stanford professor and co-author of the study, said this: "We learned it's really a quagmire." He went on to say, "There is a perverse incentive in our society that pays more for the things we do to people than for talking and listening to people. Some of those procedures, some of those surgeries clearly are not helping people." This is huge. This is what a Stanford professor said. He called it a quagmire. So why haven't you heard about this report? Well, the report was released in March of 2020, so it didn't get the attention it deserved. So most people start with something simple like a mouth guard or a removable splint. They're often recommended by orthodontists as the first step to relieve the jaw pain. But here's the problem. These splints can actually lock the jaw in place, causing intense pain. And when that happens, patients are often pushed toward more drastic solutions, like surgery. Health authorities have even reported that some TMJ treatments can actually make the condition worse. And sadly, the story goes much darker from there. CBS Mornings aired a segment on April 4th of 2024 of the real-life horror stories of people suffering from TMJ pain. One woman had 24 related surgeries by the time she turned 50 years old, starting when she was just a teenager. She was pictured with her jaw wired shut after surgery in 2018. Another patient was told to remove her jaw joints entirely and replace them with metal screws screwed into her skull. She developed a nickel allergy from the implants. The solution for that? More screws. She had to manually turn the screws each day to try to lengthen her jawbone. She was absolutely weeping as she described the horror she was going through. I can't even imagine. And it's not just isolated cases. The National Institute of Health warns that common TMJ treatments, like installing braces, grinding down the teeth, or placing crowns, make permanent changes to the bite. That's right. You heard that right. Braces and even crowns changes the bite. And often they make the problem worse. That was exactly my experience after visiting the dentist 6 times to grind down on my crown, thinking that was the culprit and it would fix my jaw pain, and it didn't. These women were stuck on a surgery carousel with no escape. They didn't just lose mobility, they lost years of enjoying life. And those implants, they have a harrowing story. Several have been recalled or discontinued in the 1990s due to dangerous failures. Today, the FDA classes TMJ implants as one of its most closely monitored medical devices because they can cause serious health consequences if they fail. In fact, the NIH has advised TMJ patients since 2022 to avoid surgery altogether. So with all this pain, confusion, and failed treatments, what's actually being done about TMJ? Dr. Rena D'Souza, head of the National Institute of Dental and Craniofacial Research, has openly acknowledged that the success rate of TMJ surgeries is low and frankly, not very encouraging. She's calling for a shift, a bearable solution, something that actually moves the needle. The NIDCR and other experts are pushing for better education around TMJ disorders, not just in dentistry, but across all of medicines. They're also calling for more research funding because right now there's a profound lack of understanding about what's really causing these problems. Is it the jaw joint, the muscles, the cartilage? They don't fully know. And when you compare TMJ research to something like the knee joint, the difference is staggering. The National Academies of Sciences, Engineering, and Medicine, NASM, reports that TMJ research is severely underfunded and that less is often more when it comes to treating TMJ disorders. So, yes, change is happening, but it's slow. And in the meantime, people are still suffering. And here's why it matters because untreated TMJ isn't just uncomfortable, it can lead to a whole cascade of other issues. We're talking about things like tendonitis, ringing in the ears, difficulty chewing, speaking, or even yawning, arthritis in the jaw joint, tooth damage, sleep apnea, chronic pain, anxiety and depression, emotional stress, weight loss, and frequent headaches. This is why it's so important to take action early, as soon as you start feeling jaw pain on a regular basis, and to choose treatments that actually work. It was heartbreaking to hear the horror stories of these women because the solution I eventually found actually works. My major TMJ issues resolved about after 9 months, but I still had lingering symptoms that lasted for years. Clicking and popping in my jaw, and the feeling that it's going to suddenly lock up. So it gave me a lot of anxiety, especially before going to the dentist. It wasn't until 9 years later that I discovered something that changed everything for me: clinical somatic education. That's when I learned how to finally take control of the sudden onset of pain and muscle tension. And the best part, it didn't even take long. The movements were surprisingly simple and very, very effective. I have no fear anymore of going to the dentist. I no longer have extreme tightness in my jaw that was causing even neck issues and headaches. I don't get those anymore. So, yes, there is a way to relieve your TMJ pain. It doesn't involve surgery. It doesn't involve putting anything in your mouth. It doesn't involve any type of appliances or devices or having to go through insurance or keep going to all these professionals. There's no surgery or drugs or any type of invasive treatments whatsoever. It is completely natural. So here's how it works. To truly relieve TMJ pain, you have to address the entire pattern of tension in your body. It's never just one muscle. If other muscles are stuck in tension, your jaw won't fully release either. That's why you need to work with your nervous system, not just your muscles. And that's exactly what clinical somatic education does. It's a method of neuromuscular education created by the late Thomas Hanna. He created self-care exercises using a technique called pandiculation, which helps release chronic involuntary muscle tension and retrains the nervous system. Pandiculation works by contracting and slowly releasing a muscle or a group of muscles in a specific way. This then sends accurate biofeedback to the brain, allowing your body to reset its resting level of tension. When these movements are taught in a specific order, they can release tight muscles and correct imbalances throughout the body. But it's important to learn them properly. From a certified exercise instructor trained in clinical somatics, my name is Julie Cott, founder of Midwest Somatics and Wellness. I'm a level 3 certified exercise instructor, certified by the Somatic Movement Center. I've helped people transform their lives by retraining their nervous system, moving from painful to pain-free. And now I want to help you do the same. If you're struggling with jaw pain and want to know what's really going on, take my free jaw tension self-assessment quiz. It's the first step toward unlocking your pain. And it'll also give you early access to my upcoming Unlock Your Jaw course. You'll be added to the waitlist, get exclusive updates, and be the first to know when my course goes live. Don't forget to subscribe to my weekly emails for tips, resources, and course announcements. And if this video helped you, please give it a like and subscribe. It helps others find this message too. Thanks for watching. I'm so glad you're here.